Now, for the management of infection, you need to know that when you want to manage infection, you are going to have different elements in the management of infections. Is it clear? So the first element in the management of infection is a principle of management. Principle of management. Is it clear? You need to know that generally when you want to manage infection, is you have to manage the disease, you have to manage the causative agent, you have to manage the complication, you have to manage the background. Is it clear? Now, when you manage the disease, you have to use the principle of management. Is it clear? And the principle of management of infections is that you have to manage the local spread and then you manage the systemic spread of the disease. Is it clear? That is the general management or principle of management of disease. So for the local spread of the disease, how do you manage the local spread? You manage the local spread by giving something that is going to attenuate the microorganism at the locality. Example, if you have an infected ulcer in necrotizing fasciitis, is it clear? To manage the local spread, you're going to give what? You're going to put you're going to do antimicrobial wound dressing that you're going to understand best when you're going to go at the level of wound dressing. Is it clear? If you have a patient that has pneumonia, in order to manage the local side, you can do physiotherapy, chest physiotherapy, in order to know the best position that you can cough and it can going to result to a productive sputum. And you can also give carbocysteine, which are expectorants, such that the sputum can easily be removed. That one is going to be used in the management of the local spread. Is it clear? Now the next one, and also in the case of an upper respiratory tract infection, you can do a nasal lavage. Is it clear? In cases of children, if you have a septic arthritis, for the local spread, you can do aspiration with arthrocentesis. Is it clear? So those are the different elements that you can do in these cases. Now for the systemic spread, now you need to know that we can do other elements in systemic spread. In systemic spread, you can, in order to evaluate for the systemic spread, you can do now antibiotic therapy, and the antibiotic therapy that are used in the systemic spread are the empiric antibiotic therapy. Is it clear? The empiric antibiotic therapy when there is a systemic spread. Generally, you need to know that what the empiric antibiotic therapy is a trial of a third generation cephalosporin. Is it clear? It's a trial of third generation cephalosporin plus plus a third generation cephalosporin plus an aminoglycoside. Is it clear? Plus an aminoglycoside plus a third generation cephalosporin plus an aminoglycoside plus a nitroimidazole. Is it clear? So generally, when you want to do empiric antibiotic therapy, those are the three things that you do. And for the third generation cephalosporin, what you do there is that you are going to give ceftriaxone. You have ceftriaxone. For the aminoglycoside, you give gentamicin, and then the last one, the nitroimidazole, you give metronidazole. This is the empiric antibiotic therapy generally used in our wards. Is it clear? The other empiric antibiotic therapy is going to be fluoroquinolones plus fluoroquinolones plus nitroimidazole. Example, we have levofloxacin or ciprofloxacin plus a metronidazole. Is it clear? So those are the empiric antibiotic therapy, and this empiric antibiotic therapy are rotated such that the antibiotic resistance should reduce. Is it clear? So those are the different elements that you have to do when you are doing an empiric antibiotic therapy. Is it clear? Either you do empiric antibiotic therapy as such. In this case, you do this type of empiric antibiotic therapy when you have a polymicrobial infection. Is it clear? When you have a polymicrobial infection in front of you, this is how you do the empiric antibiotic therapy. Is it clear? But if you have microbial infection which are much more as a result of one particular etiology, you now use the antibiotic with respect to the classification of the SchrDbb. Is it clear? You use the ATB as the antibiotic with respect to the SchrDbb classification of the microorganism that we have done initially in the former tutorials. Is it clear? So those are the different things that you have to do in the principle of management. Now you need to know that the next one after the principle of management, you have now to treat the cause. To treat the cause now is after the sense cause and sense the cultural sensitivity, that the cause the antibiogram is going to come and you're going to treat the cause. To treat the complication now, you need to know that what we said, that the major pathophysiology under which we are going to have the complication was via the first one, the immune response. We talked about the mechanism, that there was immune response and there was also the infection. Is it clear? The infection control was done with the local and the systemic spread. But now for the immune response, you need to know that every time there is an infection in front of you and then the patient is immunocompetent, the patient is going to try to have an over immune response. Is it clear? The patient is going to try to have an over immune response. So you need to always control an acute infection with an anti-inflammatory medication. And the anti-inflammatory medication are best pain relief medication. They're the best pain relief medication in cases of infections. If you have a septic arthritis, the best pain relief medication is an anti-inflammatory medication. If you have meningitis, the best pain relief medication of the headache is an anti-inflammatory. If you have pneumonia, the best pain relief of chest pain is going to be an anti-inflammatory. So those are the terms that you have to know. The anti-inflammatory is going to be the best pain relief here because it's going to reduce inflammation, that reduces the pain associated with the signs of inflammation. Now, the best pain relief, you need to know that what the question now is, which anti-inflammatory should be non-steroidal anti-inflammatory drugs like ibuprofen, like ketoprofen, like all these other drugs, ibuprofen, diclofenac, ketoprofen. Is it non-steroidal or is it steroidal? Now, to know if you are going to give a non-steroidal or steroidal anti-inflammatory drug is on the side of the infection. Is it clear? If the site of the infection is more water soluble, you give non-steroidal anti-inflammatory drugs. And if the site of the inflammation is more of fatty soluble, you give steroidal anti-inflammatory drugs. So example of location where you have infection which is much more water soluble, the urinary tract infection, water is much more in the urinary tract, so you give non-steroidal anti-inflammatory drugs in that case. In septic arthritis, there is much more synovial fluid with fluids of water inside the joints, so you give more non-steroidal anti-inflammatory drugs. Is it clear? In the lungs, you much more have fluids that are going to cause a consolidation, so you give much more of non-steroidal anti-inflammatory drugs. But to give steroids, you give steroids in fatty surfaces like the brain. When you have an encephalitis or a meningitis, it's meant to give steroids. If you have inflammation at the level of the back, a transverse myelitis of the spine, you give steroids. Is it clear? So steroids are going to be best used in those cases. Is it clear? And steroids can also be used when you have hypersensitivity reactions like the type 1, type 2, type 3, type 4 hypersensitivity reaction. To control all those types of hypersensitivity reaction, you are also going to give steroids. So those are the different elements that you have to evaluate when you are going to manage this patient. Is it clear? Now, after the management, we now move to the next part of infection, which is the follow-up. Now, to follow up a patient, you need to know that the follow-up is going to be divided.